Elhasany. I'm an emergency medicine consultant and associate professor at New Giza University, Egypt. Well, today I'm going to talk about artificial intelligence in emergency department. And before starting, I would like just to declare that I have no conflict of interest to declare that could influence this work. Now, by the end of this talk, which I hope it's going to be a very lovely one, I hope and it's going to be an easy one, I'm going to explore the basic information about artificial intelligence and identify what's meant by deep medicine. I will explain the artificial intelligence uses at emergency department, comparing advantages and disadvantages of its uses. Well, what's artificial intelligence? Artificial intelligence is one of the commonly used terms nowadays in the social media and everywhere. Artificial intelligence, in simple words, refers to the simulation of human intelligence in machines, using machines that are programmed to think and learn like humans. So it's a program or a software that act like a human body or a human brain. So this is artificial intelligence. And to know a little bit more about artificial intelligence, I will go back in the history to know more about the development of artificial intelligence. So back in 1950, the artificial intelligence originated, representing and simulating intelligence in machine. And it was, and still, it's a subset of data science. In 1960, there is a machine learning in the practice of getting machines to make decisions, which is called machine learning. So this is the new term that has developed in the 60s, machine learning. And artificial intelligence is considered as a subset. Machine learning is a subset of artificial intelligence. Going a little bit into more depth of this artificial intelligence and this kind of science, there is the deep learning. Back in 1970, deep learning means that the process of using artificial neural network to solve complex problems. So this is basically the history of artificial intelligence back in 1950, going to 60 with the machine learning, ending with deep learning. Well, currently in our medical field or in medicine, there is a concept that is called deep medicine. So what is deep medicine? Basically, deep medicine explores how artificial intelligence could dramatically reshape the healthcare industry, from how illnesses are diagnosed to the ways patients are cared for, according to each patient's individual characteristics. So this is deep medicine. One of the pioneers in the field of deep medicine is a cardiologist named Eric Topol. And I quote this from his book, in the next several decades, physicians will be able to delegate a lot of their everyday tasks to artificial intelligence. Deep medicine actually is a part of the or a subtype or a field in the in medicine, and it's not commonly used term. But I found that this cardiologist, the founder, one of the founders, together with some university, are talking about deep medicine. Again, back to Eric Topol, he mentions that deep medicine is the practice of the use of artificial intelligence while maintaining and improving personalized or individualistic patient care. And this is the most important part. We are not getting away from an individualized or personalized patient care. Currently, in our emergency department, the current status that most of our clinicians are overworked. They are rushing and running between one patient to the other, truly trying to empathize, but without the true empathy. They are trying to listen, but they don't have the time to be there for all patients. So artificial intelligence has the power to change this, and perhaps paradoxically, to bring the human side back to medicine. Now let's go for the uses of artificial intelligence in emergency department. And to go further in this part or in this area, we have to imagine and illustrate the phases or the stages the patient go through, starting from his home complaining at home until his actual visit within the emergency department. So as we all know, I believe, that the patient start with calling emergency medical service, to call an ambulance, to go for an hospital. Once a patient is inside an hospital, a registration phase and a triage phase start. Then this is followed by an evaluation, interpretation of investigation, either radiology or lab, ending with a disposition. So basically, this is an illustration of what happens within emergency department. And based on this diagram, we can talk about different uses of artificial intelligence through all those phases. Now let's talk about one of important use, which is the triage and prioritization. There are different tools used by different hospitals that integrate AI algorithms to analyze patient data, the data that has been entered by the triage personnel within the triage area. And these AI tools can analyze the severity and determine the severity of the condition, prioritizing cases accordingly to ensure that most critical patient can receive immediate attention. In the same area, which is the triage and patient prioritization, AI tool can process a real-time data using wearable devices like smart watches uh, or something like similar like smart watches, where it can detect all changes, all real-time changes occurring in patients, like a change in pulse, change in blood pressure, and can detect all the change or the trend in the vital signs changes. And it has the advantage of detecting or comparing this with the medical record of patients. For example, a patient coming with a borderline blood pressure, it might compare it with a previous blood pressure recording, like in patients who are having an impaired cardiac function or heart failure. They might have a baseline borderline blood pressure. So it can compare previous blood pressures and can tell me that this is in a borderline blood pressure or this is a very critical situation. Another field that for which artificial intelligence can be used is the diagnostic support. Well, and definitely, I believe that many of you might have some sort of an information about this. In the medical imaging, AI algorithms can analyze X-ray, CT scans, and MRI to detect abnormality, especially like fractures, tumors, especially the minor and complex cases. It can help to accelerate the decision making, especially in most hospitals. The time reported varies from 1 hour to sometimes a couple of hours, up to 6 hours in some of hospitals that I know, and up to 24 hours for medical image reporting. So such tools can help accelerating the diagnosis of such patient. It's not only a medical image. We can use this to support our diagnosis for lab results. AI tools and algorithm can be used to help identifying patterns and anomalies that might be missed by human clinician as regard the lab result. Other uses of emergency in the field of predictive analytics. What's a predictive analytic? Basically, we can predict their deterioration through analysis of their trend of vital sign. So AI models and artificial intelligence algorithm can predict which patients are at risk of deterioration, enabling proactive intervention. And this is the most important part in this. Detecting early detection of deteriorating patient can offer proactive intervention for those patients, preventing their further worsening of their condition. Sepsis detection is also one example of predictive analysis, and there are numerous tools that are approved by, example, the FDA for detection of sepsis. The one advantage offered by this tool, this kind of AI algorithm, that it can early detect signs of sepsis, allowing clinician to provide early intervention. And also outcome prediction. AI can predict patients' outcome based on historical data, helping clinician to make much more informed decision about treatment plan, especially when there is some sort of a background oncological condition in their history. Another example for the use of artificial intelligence is the resource management. And I'm talking about staff optimization and resource allocation. Staff optimization is trying to analyze and predict the times where there are many patients within the emergency department, can predict patient influx and patient flow to optimize staffing at those kind of timing. So by preparing the staffing and the manpower for physicians, nursing staff, nurse assistant, we can increase the number of working staff, the healthcare providers, during the rush hours, during holidays and weekends, based on actual analysis of data. So this is very useful for staff optimization within emergency department. Also, resource allocation. Resource allocation in this part means that using artificial intelligence algorithms or tools, we can detect the occupancy of ICU beds, the availability of ventilators within in a hospital, and also this can help emergency medicine dispatcher to allocate patients who in need for, definitely, for example, if it's diagnosed by the paramedics that he needs further help and intensive care, we can allocate them directly to the place or to the hospitals where there is some sort of available beds. And in my country, we have a primitive initiative as regard the number of beds, ICU beds and ventilators that is collected in a central area. Any hospital is in need for an ICU bed in case there is a delay or there is no available ICU bed. They can contact this central station for the ICUs to help patients get accurate and fast medical care. Number 5, as part of AI uses, is the workflow optimization. And here I'm talking about both clinical and non-clinical optimization of workflow. And non-clinical is the administrative part or the administrative tasks, such as checking data entry, documentation, allowing healthcare provider to focus more on patient care. As regard clinical decision and support system, AI can provide evidence-based recommendation and alert all clinician, enhancing decision-making processes. Telemedicine and remote monitoring is also an important field where AI is trying, and there is a lot of software nowadays are utilized for virtual consultation. Virtual consultation, for example, if one hospital is collaborated with a different hospital in a different country, or within the same country, there is some sort of a virtual consultation for toxicological cases from toxicology centers. It can be used for this, providing instant consultation for the hospital using such telemedicine. Also, wearable devices can be used to send their data to the hospital. And I can remember one incident that I read about. One of the famous wearable devices, one of the famous brands, detected that its owner is having a very seriously low pulse rate after an accident. So it makes some sort of a contact with an emergency medical service, and actually they sent an ambulance to find out that this patient went into an accident, and this is why he was having a very serious low blood pressure. It was the patient was about to have a cardiac arrest, and that this patient was managed by just sending some sort of SMS or SOS alert through this wearable devices. Again, another area or another domain where AI can be used in emergency department is the personalized treatment plan. It can be tailored for the patient, a tailored intervention based on the patient data, including genetic information. Medication managed also can be tailored based on the patient medical condition. Is the patient having some sort of a renal impairment? What's the best dose for those patients? Do we have a critical interaction according to the drug appropriateness or medication appropriateness? Nowadays is very important part in the quality of any emergency department to make sure that patients are receiving a well and safe medication plan. Training and simulation using the virtual reality simulator is one of the famous field where artificial intelligence is used, especially in the field of emergency department. Many emergency cases cannot be assessed and cannot be trained out of the emergency department, and the only way to help students to learn such emergency situation, either in those who are having an emergency training or other than emergency like surgery or medical training, they can provide virtual reality simulation to help them learn and help them have their feedback and to know what's the mistake. This is an instant real-time feedback, so it can also not only providing a virtual reality simulation, but also can provide them a feedback that can help them to improve their studying methods. And patient engagement. And this is almost the last thing I'm going to use as regard the uses of artificial intelligence in emergency department. Nowadays, there is a lot of chatbots and virtual assistants. It can be used in emergency department to help not only in emergency department, even before the patient comes, using program or software like symptom checker to chat with a software or with a virtual assistant to write down what are the complaints or what are the symptoms experienced by the patient, to tell the patient what level of or what is the triaging level. Is it suitable for emergency department to go for such symptom, or it is suitable for this complaint to go for the outpatient clinic? Providing chatbots or virtual assistant is also an important domain where artificial intelligence can be helpful. Follow-up care, having the instruction post-trauma or post-wound care can be generated and can be accessed using the AI systems, instead of providing each patient a paper form for such follow-up care. We can remind patient about their follow-up appointment for their wound care or whatever. If a patient, for example, is advised to have a GP follow-up, the AI systems can read this and go for a text mining to check within the medical record and arrange an appointment for the patients. To summarize the uses, basically, patients sometimes go through self-triage using a symptom checker. Then artificial intelligence can be used to emergency medicine medical dispatch, going to the most appropriate place for them. Registration is one area for the AI to be used by the patient for data collection, for symptom checker, and for to help the diagnosis, and it can help patient during ED triage. It might help the burdened, overworked nursing staff or the staff within the emergency department. It can be used to help in the consultation and the discharge plan of the patient. There are numerous examples. Those numerous examples, and I'm not going to talk about any particular names or brand names for software, but I can tell that this photo, which is from ResearchGate, can tell that there are many software developers and many companies are involved in the development of such software. There are numerous feedback about the uses of artificial intelligence. Basically, most of the physicians are happy using the artificial intelligence program, yet other software other physicians are a little bit concerned, and they believe that there are some sort of challenges. Continuous collaboration between AI developers and healthcare provider is very important to overcome such challenges. Based on what I have said, so I'm going just to explore and to compare some of the positive and negative sides of using artificial intelligence within emergency department. Basically, the positive, and I will start with the positive perspectives: improved efficiency and workflow. Definitely time saving and faster diagnostic. Using artificial intelligence for the administrative task, reduce the paperwork and improve the patient flow. It can help for a faster diagnostic decisions, especially as regard medical images and lab results. And that ends in positive or time saving. Enhanced diagnostic accuracy, eliminating human errors and reducing the error. Supporting a decision maker also is an important positive perspective of using artificial intelligence in emergency department. Predictive analytic, the use of predictive analytic like the sepsis campaign can provide proactive care, and it can the resource optimization can help to minimize the time for the patient by sending them to the most appropriate health care center appropriate for their condition. Learning and continuous improvement is also a very important area and positive as regard the use of artificial intelligence, especially using different educational tool, educational platform, artificial intelligence softwares and simulators. On the other side, I'm going to talk about the cautions and critical perspective or the negative sides of using data privacy and security. Actually, there is no solid protection that can be promised. There is a lot of hacking, software hacking, and physicians are concerned about the security and privacy of the data. All quality, hospital quality, they are almost taking care of the patient quality, and there are concern as regard the patient privacy, especially using the advanced AI tools. Integration with existing systems sometimes is difficult. There might be a technical challenges or interoperability issues, especially when integrating the image AI system, the lab results together with the health record system. The integration might show some sort of technical challenges. Accountability and legal liabilities. This is definitely an important. Once you are going to depend on one of those decisions, are you going and are going for and court order? Is it possible to depend on AI decisions? Still, we don't have the final answer and depend on the country and depend on the regulation. And finally, the last negative, the trust issues. There is a lot of skepticism and over-reliance. It's either people or physicians are going to be skeptic about using this, or on the other hand, they might be over-relying on this one. Cost and accessibility is considered as a very important and a hindering issue using the implementation or the implementation cost and the access to this kind of technology. The future for this, there is a very important and a promising future as regard the transformation from the standard to the artificial intelligence. The take-home message for using artificial intelligence, and I use this quote from Eric Topol's book, The Deep Medicine: artificial intelligence will not replace physicians. Physicians using AI will replace those who do not. Thank you all for listening, and I'm happy for any questions.